A very good afternoon and a very warm welcome to one and all who has joined us for today's webinar. We thank you all for your interest in participating in this event, which is centered around the topic of mental health. I would request all of you throughout the course of the webinar to please keep your microphones on mute. Okay, thank you. So on the occasion of World Mental Health Day, which is observed on 10th October of every year, International Institute of Health Management Research brings to you an afternoon of talks and activities centered around this year's WHO theme. So to start off, I invite Dr. Shrutapa B. Niyogi to deliver the opening address. Professor Niyogi is a public health specialist. She's the director of IIHMR Delhi, and she's actively engaged in research and teaching. She has a rich experience in public health and is particularly interested in implementation of epidemiological and clinical research-based projects centered around maternal and child health, and those with great relevance to national policies and programs. I welcome you, ma'am, to please deliver the opening address.
Thank you, Dr. Rupsha, and a very good afternoon to all of you who have joined for this webinar. This event is particularly meant to celebrate the World Mental Health Day, which is supposed to be celebrated on 10th of October. So this day is basically marked to increase awareness on mental health education, and also this day is celebrated to advocate against the social stigma which is associated with mental health issues. The day was recognized as a World Mental Health Day for the first time in 1992, I think, and that was initiative which was taken up by the World Federation of Mental Health, and that is basically a federation which has more than 150 countries in its fold. So we all understand and we believe and we know that mental health problems are growing at a very fast pace. In fact, COVID has also aggravated some of these mental health issues. And not only that, it has also exposed the gravity of the problem. And according to several reports, including the one which has been released by WHO, India is considered to be one of the countries where maximum, depressed people or patients or people with some or the other mental health disorders, they exist. So, and the report says that out of, I think, one out of every 6 to 8 people in India, they have suffered from mental illnesses at one point of time in their lives. And more important than everything else is that India also has a very low number of health professionals to cater to the huge demand which is there in existence. So as health professionals, I think what the minimum that we can do is to improve awareness in the community and to sensitize the health professionals about the need and the requirement of these mental health issues. So with that, I welcome you once again to this important event. And I now hand it over to Dr. Rupsha, please.
Thank you so much, ma'am, for introducing the significance and the importance of today's event to the audience. Like we have heard, so the World Mental Health Day is celebrated on 10th of October every year. And each year, WHO joins in celebrating this day by raising awareness among the population regarding mental health issues, and it focuses around one theme every year, which is a mental health issue of public health importance. And WHO also organizes a campaign around these themes. And this year's theme for World Mental Health Day is Mental Health Care for All. Let's make it a reality. So we are just going to look at a little more into WHO's campaign. So this is the 2021 campaign of the World Health Organization. And this year, so we know that it's been around 1.5 years since that the COVID-19 pandemic has started, and the pandemic has adversely affected all countries and all populations, including mental health. Around the world, there are populations, there are people who lost their loved ones, lost their jobs, faced a lot of issues in their personal lives because of the pandemic, and as a result of which we saw an increase in mental health problems, especially common mental health problems like depression, anxiety, post-traumatic stress disorder. And so with this in mind, with this as the background, World Health Organization decided to focus on improving mental health services, because the pandemic also lay bare the inadequacies in the health system to uh, provide services, including mental health services, to the population. So the focus of this year's WHO campaign is to scale up quality mental health services at all levels in the post-pandemic world. And since depression is one of the most common mental health conditions, WHO also focuses to raise awareness regarding this condition and helping people live with depression. It also focuses on increasing awareness regarding mental health issues and how to cope and seek help in difficult times, and also empowering people with mental health disorders to look after their own mental health, and also provide support to others around who might need help regarding mental health issues. So we know that mental health is there's a huge disease burden. So 1 million people across the world have a mental disorder. Almost 1 in 7 adolescents experience this disorder, and 1 in every 100 deaths is by suicide. And the pandemic has only added to this already existing burden of mental health diseases. There is a care gap between the demand for mental health services and the supply of mental health care. Large populations across the world, there are many people who lack access to quality mental health services. And this has been as a result of chronic underinvestment in, especially in primary healthcare, focusing on prevention and promotion of mental health. And there is stigma, discrimination against people with mental health disorders, and human rights abuses, which only adds to this problem. It has also been seen that there's a huge economic cost. So it has been estimated that the lost productivity, which results from only the two most common disorders, which is depression and anxiety, it costs the global economy almost 1 trillion US dollars each year. And there is also a chronic underinvestment. So there's investment deficit in mental health care services. On an average, only 2% of the national health budgets across countries are actually spent on providing mental health services. And even among the developmental assistance for health to most countries, less than 1% are channeled towards mental health services. But all is not bad, there is good news. So in mental health disorders, there are things which we need to remember when we talk about improving mental health care services. So some of these are that common mental disorders can be treated. So disorders like depression, anxiety disorders, these are known as common mental disorders, and these include the largest chunk of the mental health problems that we can see across the world, and these can be treated. Premature deaths can be prevented by providing care and support to people with mental health disorders. In absence of mental health specialists, general health providers, general health workers can be involved to provide uh, the basic diagnosis and treatment of disorders, and then refer to the mental health specialist wherever available. Caregiver support for people living with mental health disorders can improve their quality of life. And it has been estimated that investing in prevention of mental disorders, in mental health promotion, can actually provide return to investment, which is massive. So it has been estimated that for every $1 invested in scale up of treatment of depression and anxiety, can actually, there's a return of $5. And for every $1 which is invested in evidence-based treatment of drug dependence, can actually give returns of $7 in terms of reduced crime and criminal justice costs. So there is positive news. There is a lot of scope that we have for improving mental health services. And with this in mind, the World Health Assembly this year, all the governments of different countries who are signatories, they pledged to take forward the comprehensive mental health action plan, which has been proposed by the WHO. So the core objectives of this mental health action plan, which provides a pathway, which provides a trajectory to all the member countries as to how they will be able to increase mental health support and reduce the burden of diseases. There are 4 core objectives focusing on strengthening effective leadership and governance, providing comprehensive mental health care integrated with primary health care systems, implementing strategies for mental health promotion and prevention of mental disorders, and lastly, strengthening information systems, evidence, and research for mental health. There are several global targets which are drawn to, to the year 2030 to reduce the mental health burden, and we have another 9 years. So all member countries have drawn up their own plans and policies and programs to meet these targets by the year 2030. And the core principles, the key principles which govern attainment of these goals include universal health coverage. Universal health coverage, first of all. So making sure that everybody can access quality mental health care without having to undergo any financial burden. Focus on human rights, which prevent stigma and discrimination and human rights abuses against people with mental disorders, which is so very prevalent in most countries across the world. Evidence-based practice of mental health interventions based on scientific evidence, based on research. Adopting a life course approach in providing mental health services at all stages of life. Then adopting a multi-sectoral approach to partner multiple public sectors as well as the private sector in delivering mental health services. And last but not the least, empowerment of people with mental health disorders in mental health advocacy, planning, policy making, and up to service delivery, monitoring, research, and evaluation. So I will end here, and with this background, I would now like to invite Dr. Naveen Kumar. Dr. Naveen Kumar, sir. Yes, sir.
Yeah.
Yes, sir. So just a second. Thank you for joining us, sir.
Thank you for inviting.
So, so this session, the next session will be taken by Dr. Naveen Kumar. Dr. Naveen Kumar is the professor and head of Community Psychiatry Unit, Department of Psychiatry, NIMHANS, Bangalore. His area of interest are community psychiatry, forensic psychiatry, telepsychiatry, and disaster management. Dr. Kumar has numerous research projects, awards, and publications to his credit, and he has been running community intervention programs in 2 rural taluks of Karnataka since the past decade, identifying and following up 2 cohorts of schizophrenia patients in these talukas. Sir, I invite you to take the next session on focusing on universal health coverage in context of mental health. Over to you, sir.
Thank you, Dr. Banerjee. It's my pleasure to be part of this very important initiative by the Institute, and let me share my presentation.
Sure, sir.
Just a minute. Yeah, so is it visible now, the screen?
Yes, it is visible, sir.
Yeah, so I'll be talking about universal health coverage, particularly focusing on mental health. As Dr. Banerjee was pointing out many issues, I'll just delve more into the relevant things about mental health, because mental health is a very, very huge thing, and whatever we speak in the next 5-10 minutes is not sufficient for anything. But just to give a glimpse of the scenarios, universal health coverage is something, the concept is given by the WHO, the World Health Organization, looking at the context that, half of the world population lacks essential health coverage, and significant out-of-pocket expenditure is occurring for health, related issues. In India, particularly for mental health, in our own National Mental Health Survey, the out-of-pocket expenditure was calculated to be about 1,500 rupees a month, and because the insurance is not there, so on and so forth. So there is significant OOP, And it's also a known phenomena in the country that healthcare expenditure pushes people into poverty, particularly in the context of mental health. This is also this phenomena also is known, because before they come to us, they would have exhausted 1 lakh, 2 lakh rupees, and then after no treatment, or the patient doesn't become better, then they reach tertiary care institutes. So this kind of scenario is there in significant proportion of the world population. So, so how do we understand this universal health coverage? The definition is very, very broad, which is actually required, and it says that all individuals and communities receive health care they need without suffering financial hardship. So that is the most important concept. And UHC also envisages a full spectrum of mental health care, including promotive, preventive, treatment, rehabilitation, and palliative care. Achieving universal health coverage is one of the sustainable developmental goals of the United Nations. What it does not mean is that it does not mean free treatment for all ailments. And it's not just about health financing. It encompasses diverse sectors, not just the health sector, because health is tied up to various other sectors in the society. It could be women and child development, industry, forest, environment, climate change, so on and so forth. Multiple other sectors are involved. So all these sectors will have to interact with each other to make this a reality. So when it comes to mental health, this, of course, I think everybody is aware of this as a public health concern. A recent Lancet, this is of course 2016 data, a recent Lancet publication in 2020 pegged this number to about 200 million in the country. That is about 20 crore population. They do require some sort of support, when it comes to mental health and mental health problems. So it's a huge public health concern. There's no doubt about it. But there is something called as a treatment gap for different mental disorders. Treatment gap, simply put, is what proportion of those who deserve treatment they are not able to access or able to access. So for bipolar affective disorders, it is about 71%, 70%, and for alcohol use disorders, it's about 86%, according to the National Mental Health Survey. That means that for every 100, only 30% of them will receive treatment for bipolar disorder, and 70% are not receiving any treatment. So that is the meaning. When it comes to alcohol use disorder, almost 4 out of every 5 persons or patients, they will not receive any treatment. So that is what is the meaning of treatment gap. So the gap is so huge. And madam was initially talking about the huge dearth of specialist human resources in the country, be it psychiatrists or clinical psychologists or psychiatric social workers or psychiatric nurses. Just to give you a glimpse of that scenario, in a country which has about 140 crore population, there are about 10,000 psychiatrists. Most of them are working in the private sector. Lesser majority of them are working in the government public sector. When it comes to clinical psychologists, it is even the number of clinical psychologists are anywhere between 2,000 and 2,500. The same with psychiatric social workers and psychiatric nurses. So this is the kind of scenario with which we are working. So we need to be aware of these realities when we talk about mental health and universal health coverage. Now, as Dr. Banerjee was saying, not all is bad when it comes to mental health scenario in the country. I would like to be very optimistic because the mental health scenario in the country has changed dramatically for the good. For the past 4 or 5 years, it keeps continuously improving. I would just like to quote a few examples. One is a progressive national mental health policy came into existence in 2014. And then the Mental Health Care Act, it's a rights-based act which came into existence in 2017. And there is the National Mental Health Program and the District Mental Health Program. Although the NMHP started way back in 1982, the progress was checkered, a kind of checkered, and then it was not very fast. But over the past 5 years, a dramatic increase in the coverage of District Mental Health Program has occurred. And all these things have focused on improving access to treatment, you know, and bridging the gap by realizing the dream of mental health care for all. I am just giving you the basic framework that is existing, and of course the only way mental health can move is forward now onwards, because all the templates have been set. The policy gives us the directions, you know, which way to go. Like for example, in fact, mental health policy also talks about universal access to mental health care, which is exactly identical to the universal health coverage, you know, that we are talking about today. It also focuses on reducing risk and incidence of suicide, protection from harm, and respects for rights. That is, Dr. Banerjee was talking about it. Even Mental Health Care Act, in fact, talks about rights-based perspective, and the Chapter 5 or Section 18 of the Act clearly, they list out a lots of rights of persons with mental illnesses. What are their, entitlements, and it gives a lots of focus. It gives a lots of focus on reducing the stigma. No, I mean, it has given us the importance of increasing human resources to enhance financial allocation, and of course to advocate for appropriate identification and intervention. So mental health policy is like a very broad policy framework which is all encompassive. So based on that, many programs will have to come into existence. And as regards Mental Health Care Act, now it has become a right of every patient to access government sponsored care. And it also talks about integration into general health care, the integration of mental health care into the general health care. One interesting aspect of this act is that patients are entitled for reimbursement if services are not available at the district level. And the government has notified essential drug list, and which have been made freely available from CHC upwards. And it also has set a deadline of 10 years for improving human resources. I'm not saying that dramatic changes are occurring day by day, but definitive changes are occurring in the mental health scenario. Say, for example, the current status of mental health care in India. I'm not saying this is anywhere near, but it's much, much better than what it was maybe when I started, psychiatry post graduation. There are 47 mental health institutes across the country. There, earlier it used to be called as they used to be called as mental asylums, mental hospitals. Now they are named as 47 mental health institutes, and more than 500 medical colleges, and with associated departments of psychiatry. I don't think that all 500 have departments of psychiatry, but most of them have. And psychiatrists are present in a reasonable number of district hospitals, particularly the district hospitals of southern states. They have psychiatrists, but psychiatrists are present in very few below the ladder. So but district hospital is something is some place where you can access some sort of a mental health services. Now, when it comes to district mental health program, it is currently at least it is operational in more than 700 districts, wherein a team of a psychiatrist, if psychiatrist is not available, a trained medical officer, along with a team of psychologists. I'm not saying clinical psychologists, but psychologists, social workers, and nurses. They a team of 7-8 people are available at the district level to provide at least basic mental health services. So the situation has improved to this kind of this level in the and most of this 700 have expanded in the past 4-5 years. I'm happy to share that. And what I want to say is, at the district level, at least some services are available. Now we need to move further down, to percolate even further down to reach more people. A large private sector is there, but they're mostly concentrated in the urban areas. Now people are moving towards rural areas, but then this is the current status of mental health care. I also want to talk about this pyramid. This also is given by the World Health Organization. Now, achieving universal health coverage for mental health, I mean, it's a very gigantic and a utopian goal. That is what I would like to state. So, because Dr. Banerjee was also talking about preventive and promotive care, and that will not be, it cannot be given by any mental health professional. So that is where a lot of self-care and informal care and informal community care should be practiced. One individual will have to take responsibilities on himself or herself for her own mental health. And then as the severity of the problem increases, then the more specialized services need to be accessed. But the cost of informal care also is very low. And the frequency of the need, that is very high, when it comes to self-care, informal, preventive, promotive care. And as the severity of the problems increases, it can be the specialized services can be accessed. So WHO's pyramid of care is an important concept which needs to be given a lot of importance. We need to stress upon this. We need to talk about this, and we need to learn for ourselves what self-help skills we can learn, what life skills we can learn, how to keep our mental health, how to prevent mental health, how to promote the mental well-being. These are some of, now, the informations are available everywhere. So authentic informations need to be sought, and we need to practice this. The other way of achieving universal health coverage for mental health is to integrate mental health care into primary health care. Now, that also is a very huge task. NIMHANS is involved in an innumerable number of interventions in this particular area of integrating mental health care into primary health care by training non-specialist medical officers, nurses, ASHA workers, Anganwadis, the rural health organizers and community community health officers. That integration of mental health care should occur into the primary care. That is to synchronize the vertical programs. The vertical programs, I mean, by the district mental health programs, that has to get seamlessly integrated with the horizontal initiatives, that is health and wellness centers, the primary health centers, the community health centers. So doctors and nurses and other paramedical staff and other health professionals need to know about mental health, and then the vertical programs can give them the secondary kind of a support, secondary and tertiary kind of support for those who require specialized interventions. So that is one way of reducing the gap, and one way of achieving the universal health care. And of course, a stepwise or a phase-wise approach, because as I was talking, 20 crore is a huge number. When we say we will be able to handle all 20 crore people at one time, it's almost impossible. So we need to prioritize. We need to divide the disorders into many groups, and the greatest priority should be given for the most burdensome, or whatever logic you use. One or two disorders or categories should be focused upon for the first 4 or 5 years, and then the next disorder can be taken up for further interventions. This is about mental illness. Mental health, promotive mental health and promoting mental well-being is a totally different concept. That applies to all 140 crore people of India. And for that, I think one needs to take care of his or her own mental well-being. So this is what I have. Thank you very much for providing me this opportunity. We'll be happy to take any questions or anything. Sorry, one more slide. As I was saying, IIHMR Bharat is, one component of IIHMR Bharat is a comprehensive primary healthcare through health and wellness centers. 1.5 lakh centers in the entire country. That many are envisaged. Mid-level health providers or the community health officers are the ones who would man these centers. And one component of the 12 is mental health. So this component we have to make very, very strong, because services will be available at almost doorsteps of people. Simply because this health and wellness centers, they are envisaged one for about 5,000 population. So if this becomes a reality, and I was talking about the integration, so those are, if these things become reality, then UHC becomes a reality for mental health. So this is where I'm going to stop. And once again, I thank the organizers for giving me this opportunity. I'll stop the share now, and I'll be happy to take any questions. Thank you, Dr. Banerjee. Over to you.
Thank you. Thank you so much, Dr. Naveen. If anybody has any questions, you may please post it in the chat box. And
yeah.
Okay. So you may please post it, and then maybe we can take it a little while later. Thank you so much again, Dr. Naveen.
Thank you.
So for the next session, we have Ms. Benika Naran. Ms. Beneka is a clinical psychologist and psychotherapist. Currently, she is associated with an organization, NEEV, based out of Delhi. She has completed her MPhil in clinical psychology from NIMHANS, and she's a keen and creative young mental health professional. Clinically, she has experience of working with adolescent and adult populations in the capacity of an individual, couples, and family therapist. She is passionate about holding spaces for personal growth and self-care, emotional resilience, and mindfulness. Ms. Benika is going to lead us on a session where she's going to talk about how self-care and caring for others is important in preventing mental diseases and promoting mental health. I welcome you, Benika. Over to you.
Thank you. Thank you, Rupsa. Am I audible?
Yes, you are.
Okay, great. Yeah. So I thought in being able to provide and talk about self-care, it seems to me very crucial to be able to take care of oneself first. So I thought I'd be quite willing and keen to bring that to the discussion today. So possibly I'm keen on sharing, how self-care could be relevant in the context of the faculty and the students who've joined. So I've spoken to many professionals, I've spoken to many organizations, and we've recognized that while we acknowledge self-care is so relevant and important, it's often found quite challenging. And especially in times of such uncertainty, where all of us are going through our moments of change and grief, how self-care then becomes so difficult for the people who are serving the community. So maybe here I'm referring to, students and faculty like you, working in such spheres, and how it brings to me the importance of acknowledging and supporting the needs of this group and section. And while I recognize this, the metaphor that comes to my head is the airplane mask metaphor. So how they say that to be able to put a mask on somebody else, it's so crucial to first put a mask on oneself. And maybe through this discussion, I am hoping to evoke more reflections in all of you, to evoke more experiences of reflecting on your own self-care practices. And just to sort of begin with some theoretical understanding, self-care practices have evolved from being considered as preventive practices of well-being to more promotive practices. So than being used as crisis work, they become those practices that can bring, that can build the foundation of emotional well-being for the person. So than being saying that by practicing self-care, you're able to go through difficult times. Now the concept has changed to saying that it's not just going through difficult times, but being able to grow through them by using these practices. And when I think about that, it brings to me many studies which have worked with students, which have worked with participants involved in healthcare management, where they found that many of these participants acknowledged that their own self-care was quite compromised because of the high challenging environment that they work in. And then what they go on saying is it comes because of the belief that one holds that it's always you before me, and how there is something that needs to change there. And what these participants found helpful in being able to manage themselves despite not having self-care for themselves were community spaces where they were feeling held. So they would bring to terms times which were difficult, but they were feeling so held by their friends, their family, their colleagues. And then the point that I'd like to bring in is how self-care is not very, very entirely an individual process, but how communities of self-care can also be so facilitative, so supportive. And when we are talking about self-care and talking about self-care for all of you, another thought that comes to me is that how do we recognize when do we need it? What are those indicators that tell us that, okay, now you need to pay attention and now you need to see what's happening? And through clinical practice, maybe these are common examples of where I've found that self-care is feeling compromised. Okay, here is where we need to step back and see what's happening inside. What is not going so well in the internal world of this person. And so common indicators would be feeling that, oh, I'm feeling too exhausted all the time. Or maybe feeling like I'm skipping meals, I just don't have time for that. Or just feeling too disconnected with oneself. I don't know, I'm just not feeling myself. Or maybe working too much. So some people, when they have compromised self-care, they experience a lot of fusion with their work. And maybe by bringing this, it may help for all of us to reflect and see if we've had those moments, where we may have felt a similar way. And only by acknowledging and recognizing when do I need it and when it is feeling compromised is when one is able to then do something about it. And maybe I come from the belief that we all know that we need to care for ourselves, but just that in times of those stress and in times of worry, the ability reduces. And I wonder if it will be helpful in that moment to just check with oneself, and if it helps to just keep some time aside in the day to just check and say, hey, how are you feeling? What's happening with you today? And then asking, what do you need right now? So I find this acronym HALT quite helpful. It's the HALT, which is spelled as HALT. So it says that when one is feeling difficult emotions, they're coming from one of these feelings. Either one is feeling hungry, angry, lonely, or tired. So that's what the HALT metaphor stands for. And they say that it might be useful to just figure out and see, am I feeling hungry, angry, lonely, or is it coming from just being tired? And then asking, what are all of these feelings needing? So if I'm feeling lonely, do I need to just feel cherished? Do I need to be hugged? Do I need to be loved? If I'm tired, do I just need to recharge myself? Do I need to sit? Do I need to say something to somebody? Talk to somebody? And being able to verbalize, being able to acknowledge what's going on inside oneself is found to be very, very healing and experience in many studies. And yeah. And then when I've been talking about, how it's important to check in and ask what we need to be able to practice effective self-care, it makes me think of how a child develops the concept of self. Where does self-care come from? It's a combination of self and care. So where is this self that I'm experiencing? And usually they say, that the self is experienced by the child first in the body. When the child realizes this is my body, and that's when the child realizes, okay, this is who I am, this is myself. And that makes me think that maybe being able to tune into one's body, being able to tune into what it's giving me as a vessel that can guide me, and then be able to step back, can be quite helpful to generate effective responses then. And often what helps one tune into one's body to see what can help to take care of oneself, there could be many practices that people use, and some of these include, touching one's fingertips. So it's a simple exercise where one says that I'm feeling that I'm not in tune with my body. I'm feeling too disconnected. I don't know what's going on with me. And then just to reconnect, I feel what touching my fingertips feels like. And like that, just looking in the mirror and seeing who I am. What is my face saying? What is my body saying? Is it drooped? Is it stable? What is that wanting me to do? What sort of self-care am I needing at that moment? And maybe something like mindful movement is also considered helpful. So mindful movement would involve being very intentional with body movements. So let's say if I'm moving my hand, can I look at it as an intentional movement? How are my arms swinging? Are they fast? Do I want to make it slower? And in those moments, one experiences those pauses. One experiences those pauses where then self-care can be allowed to happen. And and another point that I thought would be important to bring in, and then it comes from some clinical practice of just seeing people who are finding themselves hard to care for themselves. So how in times of such unpredictability, practices of self-care have also changed. So how many people have found something to anchor themselves in such changing times to be quite helpful. So is there an activity like having an interaction on breakfast, having a yoga routine, anything just in the day that can be made that anchor? And how then it can be so regulating, because one knows that I'm going through so much, but then this is going to come that's going to anchor me, and how that can be experienced is very anchoring in itself. Yeah, and for many of us who've already had pre-existing difficult times, before COVID, before all of these things have happened, who've had some difficult emotional responses to deal with, how it may be helpful to find oneself a reliable group of friends, family, network, professionals, mental health professionals, some sort of activities that can support one's well-being. Activities that could be anything. It could be gardening, it could be exercise, listening to music, exploring a dance routine. However, being able to allow oneself the opportunity to explore it and contributing to that strong foundation that one is trying to build of one's own emotional health, has been found helpful. And maybe another point that seemed relevant for me to bring in talking about self-care is how I've experienced that many people find their self-care compromised, usually in interpersonal context. So they might say that I'm not able to do this for myself because I had a fight with this person, or this person said this to me, or I'm not feeling too well with this relationship of mine. And that's true. That's so true, because we're such interconnected beings. Our nervous systems are constantly communicating. And how then, in being able to bring in emotional health in an interpersonal context would have so much to do with how one is regulating oneself, and how that is so crucial too. So, if I'm having those moments where I'm experiencing difficulties in interpersonal context, would it help to just pause and say, okay, I'm going to take a deep breath and see what it's going to take. And first be able to calm oneself down, and then see what it takes to connect with the other person. See what it will take to resolve the situation. How, in that sense, it is self-care. It is self-care that happens in an interpersonal context. And while I'm talking about all of this, I find it quite helpful to also acknowledge how hard it is to take care of ourselves, to tune into ourselves and see what we need. It is a process and it is challenging. And how it's so important to be so self-compassionate while taking care of oneself. That it's okay. It's okay that I don't need to do the best self-care. And how it can come with a sense of playfulness, it can come with a sense of ease. And not like a sense of responsibility and burden that I'm constantly carrying. And and the hope is that in being able to do this, we're able to build stronger communities, stronger professionals. Who are not just going through such times, but through practices like self-care, they're able to grow through them too. That's the hope. And I'd close with that.
Thank you. Thank you so much, Venika. The audience, I'm sure, will take back a lot of points and it will help them in these difficult times and later on as well. Thank you so much.
You're most welcome, Rupsa. Thank you. Thank you for inviting and letting me share and explore this space and being able to contribute to this passion that I hold.
Thank you.
Thank you.
So again, any questions you can please for the audience, if you have any questions for Venika, you can please put it down on chat and we will just take it in a while. So now moving on, as a part of the World Mental Health Day celebrations, IIHMR Delhi had organized an e-poster making competition on the WHO theme. The competition was open to undergraduate and postgraduate students, and we received an overwhelming response of over 70 entries, 74 to be precise. And it is my pride to now present to you the posters that we received. And it was so heartening to see the interest of students, on this crucial issue of mental health care for all. And it gives me immense pleasure to share this with all of you. So yes. Before we show the entries, we had two eminent professionals who judged the entries in this competition. Dr. Isha Prasad Bhagwat. Dr. Bhagwat is a medical doctor with a public health background who's for 3 decades now a deep passion and commitment to contribute to improve the lives of the poor and marginalized and empower them to realize their rights, led him to work at the grassroots and progressively senior positions in several states of India on health, nutrition, and WASH projects. He's also associated with the Heartfulness Institute as a heartfulness trainer. Dr. Bhagwat, if you could say a few words to our participants. I'm sure they're all logged in, those who had submitted their posters for this competition.
Thank you, Dr. Rupsa. This was, good evening, everyone. This was one of the toughest assignments given to me by anyone. I think the students have done a fantastic job. Mental health is a vast subject and there's no end to it. And to capture it all in one e-poster, doing a lot of research on what the subject is all about, studying the theme for this year's Mental Health Day, and bringing out the best. I think it was a very, very excellent exercise by everyone, and it was difficult to choose between the top best. I also noted, some of them, I think, tried to make it a simple, crisp message, which was very heartening because when you see posters, a lot of them come with very crisp messages, and some have put in a very hard effort at designing a crisp message. So that was also good. But overall, a very good job done. Congratulations to everyone. Thank you, Dr.
Thank you, sir.
Before, Dr. Rupsa, can we add something about it? I mean, in the sense, may I use some of these posters for my own teaching? I'll take the permission of the winners and maybe the others.
Yes,
You
sir.
can
So
talk
with the
about posters.
permission of the creators of the poster, I'm sure it would be great to actually drive the message of mental health across institutions, across people. So I think that would be a great idea, sir.
Thank you, Dr. Rupsa.
So now I invite Ms. Jagjit Kaur. Ms. Jagjit is an experienced counseling psychologist working with Mind Solace for the past 5 years. Her specialization includes anxiety disorders, depression, stress and lifestyle management, and self-esteem issues. She follows an eclectic approach in therapy, and she has training in cognitive behavior therapy from Beck Institute. Jagjit, I please invite you to address the audience.
Hi everyone. Thank you, Rupsa, for inviting me and making a part of this program. I felt very honored, and I just want to thank all the students because while seeing the posters and trying to judge them, I think it added a lot to my knowledge and the statistics that they shared, the research that they did for mental health. I was actually amazed. I thought, this kind of understanding about mental health from students who are studying health and research policy is really great because what they are studying today and what they are going to do tomorrow is going to be very beneficial for the field. And as we are discussing the concept of health and mental health, I think both are very integrated with each other and invincible without each other. Uh, there was one thing that I would like to share as a experienced person who's dealing with people having disorders, specifically anxiety and stress. The posters were very nice. I just felt there was one thing missing in the posters was the role of a clinician here. There is a lot of knowledge on self care, what is mental health, how we need to deal with it, what we need to do in terms of taking care of our health. Uh, there is, I would say, there is a lot of psychoeducation today. What I felt was a bit missing was actually the root and the crux of the issue is the stigma people has coming to a professional. I mean, in any other medical field, if you see you have any problem, maybe a knee injury, you would like a doctor to check it if the problem is prolonged. If you try to put a balm and it didn't work and you're hurting, I'm sure week after week you would want to meet a doctor and understand from him what is the real diagnosis, or is there some internal tissue injury, so what is that is needed to be done. Similarly, in case of mental health, yes, it is very nice that people are more aware in terms of practices that help to maintain mental health. At the same time, as a community, it is also very important to deal with the stigma people has in terms of reaching out to a professional. So I won't take much time speaking on this. I think it's a very huge topic and very close to my heart, not just because I'm practicing it, but for the fact that we see the delay the people do in terms of reaching to a psychologist, and what the delay does to their life is loss of a lot of crucial years of well-being, health, relationships, their professional lives, and personal losses they go through in terms of self growth and what you call is life satisfaction and contentment. So coming back to the posters thing that I was actually assigned to do, uh, I would just want to add a technical feedback to all my students who did a lot of hard work in doing the poster making is that sometimes it's very important to understand what the crux is about in terms of relevance to the topic. Yes, there was a lot of information that everybody tried to share. Sometimes we miss on what the real concern was. The real concern here was that what is the problem solving and the solutions required to reach the mental health to all. Yes, we did talk about mental health, but what about the gap in terms of reaching it to all? So I was personally very impressed by three posters. I don't know if they will be selected or not, but those were the ones that I could actually feel that the student really understand what the real problem was that had to be, portrayed through the poster, and they were very beautifully. They had mentioned the steps, the researches, the statistics, and the global level initiatives that are being taken by all the countries towards bridging this gap between mental health services for the economically poor from different religious backgrounds, and of course, people who are living in metropolitans who are more educated and more have a more open attitude in terms of reaching to the professional. So, thank you everybody for making me a part of this whole program. I hope I get to meet the students actually one day whom I just judged. Thank you, Rupsa, and congratulations to all the students for the hard work. Back to you.
Thank you so much, Jagjit. So I'm sure our students would find that encouraging and they would take back your message and for any improvement in future. So now, without further delay, we are going to display quickly all the posters that we have received. And since there are over 70 posters and shortage of time, so I will be able to display each very briefly, but I think the audience will be able to appreciate the creativity of all these young students who participated in the contest. So just a quick glance through all the posters that we have received. So those were the posters that we had received, and so it was. I congratulate from the bottom of my heart. I congratulate all of you who participated. All of you internalized the issue and the importance of mental health. And though all the entries were brilliant and all of the entries were unique, our judges had to select 3 winners. And so now the time has come for all of us to know who the winners are. So I invite Ms. Divya Agarwal, Associate Dean, IIHMR Delhi, to please announce the winners. I will just share the screen, ma'am, 1 second.
Good evening, all of you. And congratulations for participating on the occasion of World Mental Health Day. We had a very good discussion from the prominent people who are working in this particular domain, and I could see the lot of appreciation. People have liked the session with respect to this area. During the COVID-19, it has got a pertinent effort or a pertinent focus on this particular area where everybody was inside their home and they were going through some type of anxiety or distress because they were being confined to a particular location or a particular space, right? So it was a brilliant effort by all the participants who have made the posters. We could see a glance of all the posters, and now it is the time where we should announce who are the winners, right? So I'll go in the order that I will announce the third prize winner. The third position goes to Miss Maitri Mishra. So congratulations, Maitri.
Thank you so much, ma'am.
And the second position, yes, there was a tough decision between the first prize and the second prize. There was hardly a difference of 1 point between the 2 participants. So the second prize goes to Dr. Sarvaleen. Dr. Sarvaleen Kaur. Congratulations, Sarvaleen.
Thank you so much, ma'am.
And the winner. Now I have to announce, and a lot of participants who are here, they have an anxiety in their mind who is going to win. So the winner is Dr. Kajal Gupta. Heartiest congratulations, Kajal.
Thank you so much, ma'am. Thank you for recognizing the effort. Thank you.
So, Dr. Rupsa, can we see the posters of these 3 winners?
Yes, I will do that. So I actually didn't get the time to put them all in one PPT, but I can actually show their posters in the PPT that we already have.
Right.
So just give me a second while I look for the things. So yes, Maitri. So this is Maitri's. I'm so sorry. The song will start playing if I'll show it like this only. So 1 second. I'm so sorry about that. Yes. So this was Maitri's poster that we had received, and then Sarvaleen's poster.
We could not see Dr. Rupsa. We could not see
Maitri's. Yeah. Okay, just give me a second. I will just portray it. I'll project it from here, no? Yes. So this is the poster made by Maitri, who has won the 3rd prize. Then coming to Sarvaleen.
Have you shared your screen?
We can't see it, Dr.
Yeah, we can't see
it. I am so sorry. I'm so sorry.
Your screen.
I thought I had shared my screen. I am really sorry. 1 second. Let me go back to my
threes. Yeah. Now we could see.
Let me go back to my threes. Yes.
Okay.
Second, third.
So this is the poster made by Maitri Mishra, and who fetched the 3rd prize. And now let's go to Sarvaleen's poster. So this was the poster made by Sarvaleen, who has fetched the 2nd prize. And Lastly, firstly, rather, so Kajal's poster was it was a lengthy poster, so we had to put it side by side. But this is actually it's a poster in the portrait format, and this is the poster made by Kajal Gupta, and so we have combined the scores of both the judges to come to the final scores for all the posters, and in the combined scores, Kajal has won the first prize.
So can we see the winners? Please
Thank you.
switch on your videos, all the 3 winners.
Ma'am, actually, I'm very down with fever, so I cannot on the video. I'm down with
Okay.
fever. Yeah.
Okay, Kajal. Okay. So Sarvaleen and Maitri. Yes. So heartiest congratulations to both of all 3 of you.
Doctors. Well done.
Well done. Very good.
Thank you, judges. Thank you, participants. And now, before we go on to a very, very important session, which all of us require, of heartfulness relaxation, I will just see if there are any questions for our guest speakers. So there is one question which says, what do you believe is important for anyone to be aware, or what they should know if they know someone with a mental health issue? So I think the question is about how to identify a person with a mental health issue. Dr. Naveen?
Yeah, thanks, Rupsa, for that question. I also have a request. I have another engagement. So there are some 2-3 questions. So I can take up all of them, and I may be permitted to
Yes.
leave.
Sure, sir. Yes.
Thank
if you have identified the questions already, then you
yes.
can
Yeah, so I think, the question is about how to identify. There are various symptoms. Mental illnesses, I am just concentrating on mental illness, the disorders per se, not see, there are so many mental health symptoms. Those won't constitute any disorder. The disorder issue comes if there are, the collation or the co-occurrence of one or two or more symptoms in a characteristic fashion. Say, for example, there are many psychiatric disorders. They're broadly classified into severe mental disorders and common mental disorders, various kinds of severe mental disorders. So the symptoms are in the realm of thinking, emotions, and behavior. So there are some abnormalities in behavior. Behind those abnormalities will be abnormalities in the thought process or the emotions, or sometimes and of course the cognitive functions or the higher mental functions. And so all these 3 things, like a triage, they occur in various permutations and combinations, and then they will ultimately lead to abnormalities or deviations in behavior. Now, a rule of thumb, if I may say so, the rule of thumb to identify is 2 things, 2 Ds we will call in our clinical parlance. One is the distress that the person may be suffering. The second one is the dysfunction. Dysfunction in the sense they are not able to carry out their regular routine responsibilities which they are expected to. So if these things are there, then we will have to evaluate and see what kind of illness is there. I am again talking and telling that it is not about so-called worried well. I am talking about disorders, proper psychiatric disorders. That is one question. The other question is about bipolar disorder. And the other question related to that is, are there any treatments for bipolar disorder? Yes, bipolar disorder is an example of a severe mental disorder. It actually is also called as a mood disorder because the primary abnormalities is in the regulation of our emotional states. So 2 kinds of diseases disorders are possible in this. One is depression or the depressive disorders that people are very well aware of. The other opposite is the mania or the hypomania, wherein the person becomes extremely happy or irritable without any reasons for days on end. And that is a primary abnormality in controlling the elation or ecstasy, and because of which there are so many other associated abnormalities. There will be increased psychomotor activity, No, so various kinds of associated symptoms, and the question also is about genetic vulnerability. Yes, it's bipolar disorder is one of the very strongly, I mean, is an illness for which a very strong genetic contribution is there. But as a rule of thumb, I would also reiterate that psychiatric disorders are in fact biopsychosocial disorders. No 100% heritability is there in for any psychiatric disorder. The genetic vulnerabilities will act in synergy with unknown environmental factors. Most of the factors are unknown. Some of the factors are known. For example, substance use disorder. Substance use is a potent precipitant for mental illnesses, particularly severe mental illnesses. So the both of these factors combined together in manifesting the psychiatric problem. So the other question is about how to handle chronic stress. I think that the psychology colleague may be a right person to answer is what I feel. So if ma'am is able to answer, that will be good.
So I think both Jagdeep and Benika had to take off.
Okay.
But thank you so much, sir.
Yeah. So handling stress, is again, it depends on many factors. One, of course, the other colleague was talking about, promotive or preventive mental health and how to promote the well-being. The handling stress is about stress management. There are so many, of course, the time doesn't permit us to discuss things in detail, but generally speaking, we'll have to identify the sources of stress. We'll have to analyze the ABCs of those particular stressful behaviors, and then we will have to devise ways and means of handling the antecedents, the behaviors, and the consequences. So it will include various strategies. Those could be lifestyle strategies, the interpersonal skills, the time management skills, the conflict resolution skills. So it goes on and on. So it all depends on what is the source of stress, and identifying the source of stress will be very crucial. And also to understand what is the definition, what is their understanding of that particular stress. If a person comes to us with stress, he may or she may be suffering from a severe depressive episode, then the management strategy will totally be different. Or the source of stress will be an interpersonal conflict in the family, then we will have to advise them counseling or a family therapy. Or mild or moderate depressive problems could be there, so an individual psychotherapy may be the right kind of thing. So for another person, the problem may be academic stress, so we'll have to delve deep into these things. So it all depends on the context. So that is what I would like to say. I think those are the questions for me. I think that's it, Roopsa.
Right. Okay.
Right.
Thank you so
Thank
much.
You. Thank you. Bye.
Thank you, sir. Bye, sir.
Bye.
So now it is time for all of us to delve into heartfulness. And for this session, we have Dr. Bhagwat. Dr. Bhagwat was also a judge for the poster competition, so he is introduced to the audience. So, sir, over to you.
Thank you, Dr. Gupta. And may I share a screen, please?
Yes, sir, definitely.
Can you see my screen?
Yes, now we can see.
Okay, good evening, everyone. There were a lot of questions about stress. And while judging the posters, I could see a lot of, I think nearly everyone had said meditation helps to prevent a lot of mental health problems. Mental health, as we all understood, is a vast subject. In fact, stress and anxiety are experienced by everyone. So I thought a short session on how to do heartfulness relaxation will be excellent. Heartfulness is a heart-based methods of living, and we practice meditation. I've been doing it. I'm a public health consultant. I've been practicing public health, but also meditating on my own. So I find it useful. I find meditation useful. So I thought I'll share with you how meditation can help to prevent the manic stress. You see, stress is a natural thing. It's a feeling, first of all, of emotional and physical tension. It's just a feeling, remember this. And stress is part of our system. We evolved from certain, primitive structures, primitive organisms, and they were all, designed to, manage a lot of, situations where they have to fight or flee or whatever. So stress is natural. Anxiety is the body's response to stress. And a lot of things can actually lead to stress, and we know the COVID-19 pandemic has increased stress and anxiety. Remember that a bit of stress is actually good for everyone, and it's natural. For example, exams can lead to stress, but then stress is necessary for us to do something. Before we do something, a bit of stress helps. The challenge becomes when stress becomes unmanageable and anxiety actually rises too much, so that you start worrying about the thing. You start, a lot of thoughts, unnecessary thoughts come into the system. That is when stress we think causes problems. Our usual response to stress and anxiety is drink increased coffee. Some of you will be unfortunately, smoking, and in stress situations you feel like smoking more. Some of you may be consuming alcohol too. And a very common reaction for everyone is increased worries. You get into the cycle of unnecessary worries. And all these are injurious to health. We are not able to sleep well. Some of us gain weight because of this. And nowadays we are seeing that younger and younger populations are developing hypertension, diabetes. Apart from all this, we enter into a cycle of negative thoughts. I think one of you was asking, how do we address increased stress? It is partly because of the cycle of negative thoughts that comes into the picture. Now, let me just quickly look at how does meditation help manage stress. We have two nervous systems which are in the body. The sympathetic nervous system helps us to fight or flight or freeze. It's naturally given to us, so that when you are, in any situation where you feel like, just raising a fight, the sympathetic nervous system comes into action. The parasympathetic nervous system actually helps us rest, digest, and repair our body. Generally, during the day, the sympathetic nervous system is active. That is when we face everyday situations. And at evening and night, when we rest, we have the parasympathetic nervous system taking over, so that the body rests, it digests the food, and the body repairs itself. Meditation actually activates our parasympathetic system so that it calms and regulates the mind. And this actually breaks the cycle of stress and exhaustion. And ultimately, it also leads to increased system activity. I'd just like to introduce one thing here, that meditation is actually meant to be a core spiritual practice. It's a part of the spirituality systems that are being practiced every day. One of the benefits of meditation is the stress management help comes in. It balances the mind, and the word that we use is regulates the mind. The mind has its own actions. It regulates the mind and calms it. Meditation can also help to overcome many diseases by increased immune system activity. At the level of the brain, remember that meditation increases the alpha, theta, and delta waves. The gamma waves are necessary when we do problem solving for concentration. But most of the times when you meditate, you start getting alpha waves, so that it's reflective and restful. And sleep and dreaming also comes in. The beta waves are regulated. The beta waves show a busy, active mind, and a person who's always worrying because of stress gets into the negative, cycle of thoughts. The beta waves take over. At this point of time, when you meditate, the alpha and the delta waves, coming into action. And there is an organ called the amygdala, which leads to better function, and so that the emotions are controlled. Emotions like anxiety and too many worries and emotive thoughts, the amygdala starts functioning better. And this finally decreases pressure on the heart. And at the heart, meditation, what it does is, it also, we now know that the heart has its own neural system, so that you're able to feel and, emotions, you're able to perceive some things, you have intuitions because of the heart. But heart's role increases in the heart-brain axis because of meditation. And once again, the mind is calm because of this practice. We will do a small practice called relaxation now. It's part of the practices of heartfulness meditation. So I will urge all of you, now that we are coming to the end of the webinar, to generally start calming down now. Please sit comfortably. Close your eyes gently. Please sit in whatever posture you have, whatever posture is comfortable, wherever you're sitting, in the office, at home, or wherever you're sitting, in the library, in the classrooms. Just close your eyes gently and follow my instructions. Please start visualizing your feet. Start visualizing the divine energy coming in from Mother Earth, entering your body, the soles of your feet. Is coming in as a gentle wave, like a slow flowing river. It is slowly coming up to your ankles and slowly rising up both alongside both your legs and coming up to the knees. And from the knees, slowly climbing up like a gently flowing river, calming, soothing, divine energy coming up from your knees up to your waist. And as it is coming up to your waist, you feel that your legs are feeling relaxed, feeling weightless, and all kinds of stresses are going away from your legs. From your waist, that energy is flowing up your back. From the lower part of your back, slowly coming up and reaching your shoulders. Gentle flow of a river, the energy is coming up slowly from the lower part of your back, coming up to your shoulder blades. And now from your waist, it is coming up, climbing up from the front. It's covered your abdomen. It's covered your chest. And coming up to the shoulder blades. And as it is enveloping your shoulder, you feel the shoulders getting weightless, relaxed of all pressures, all stresses. You feel the body beneath your shoulders is completely relaxed. This energy is now from your left shoulder. It is coming down your left arm. It's come to your left elbow. It's come to the forearm. It's covering all your palms, left palm and all your fingers, and flowing away. Feel the energy coming in from your right shoulder, down into your arm, coming into your right elbow, coming into your right forearm, your right palm and fingers. You feel that the energy coming down from the shoulders from both the arms, taking away all the tensions, stresses, knots down your fingers and flowing away. So from the shoulders, the energy is climbing up your neck. It's covering your face, your eyes, your nose, your cheeks, your ears, your foreheads, and covering the entire part of your head. And all of you feeling very calm and peaceful. You feel your body is entirely relaxed. Just for a second, visualize your entire body. Wherever you're feeling any kind of stress, knot, tension, what part of the body which is not relaxed, divert the flow of energy to that part. Now slowly divert your, visualize your heart. Divert your attention to the heart. Feel the love, feel the peace, feel the calm in your heart. Let's try to drown in that peace and calm and all the love in your heart. Hold your thought there and try to drown in that particular peace, calm, and love in all present in your hearts. Gently open your eyes. The condition of calm and peace that's been given to you, try to maintain that condition for the rest of the evening, for the rest of the day. So relaxation exercise is something that we do before the heartfulness meditation. All of you must be, some of you must be practicing meditation, all of you have heard of it. Other systems practice differently, but you know, whatever be the system, I sincerely advise you to all practice meditation because it helps, it is beneficial. The focus, sleep, calmness, everything increases, and you start losing anxiety, fatigue, depression. Heartfulness meditation is one such system, and you can find out more about it from heartfulness.org. Thank you, Dr. Rupsa. I hope all of you enjoyed the session.
Thank you. Thank you so much, Dr. Bhagwat. I'm sure our audience has gone into the zone of meditation, and it was wonderful, and it was the perfect way to close this program. I thank you once again, Dr. Bhagwat, for this wonderful, brilliant session.
Thank you. I hope to meet all of you in person someday.
Yes, sir.
Thank you.
I'm sure our students would love to meet you. Yes, so thank you. So with this, we come to the end of our webinar, and I thank all the speakers, everyone who took us through important topics today, gave us insights into the domain of mental health. I thank Director IIHMR and all the faculty for their support in conducting this program. I thank the IT team, admin, and the academic team again for their support, their technical support for conducting the program. And I take this opportunity to thank all the attendees, everyone who joined us for today's event, everyone who took out time and be with us. And last but not the least, I thank all my students and students from other universities, all the students who have again submitted their posters, all the students who have participated with us in today's event. Thank you one and all. Have a good day, have a good weekend, and I hope that you are going to take back a lot of insightful information from this webinar. I thank all of you once again. So with this, we will close the webinar now.
Thank you.
Thank you, everyone.